So when I first saw that NTI hit the market, I was a very big proponent of it. I thought, here's a great appliance, FDA approved for migraine control and even parafunctional control or protective appliances for your patients. But as I got more and more involved in continuing education programs, I kind of steered away from NTIs because I'm there and listening to a course and listening to a guru talk about how anterior appliances or an AMSA or an NTI, it causes adverse reactions or it causes doubling the load of the temporomandibular joint. So for a short period of time, I let these opinion leaders sway my decision making in prescribing these appliances for patients who had temporomandibular joint problems or even patients I was worried about with restorative cases. And I went to full arch appliances or just back to full arch appliances and mostly prescribed them for the majority of my patients. But over time, as I looked at the literature and as I looked at literature that these gurus are quoting, I realized there really isn't any science or any physiology behind what they quote and what they claim in regards to having like an NTI doubling the load of the joint. And if you really look at the article that most gurus point at, that article itself tells you that there's no way to measure human joint load. And that article is in fact an opinion based upon the author, and it's built on mathematical formulas. And it's just not fact. I mean, I would look at it like, just think to yourself logically. We know with EMG studies that an NTI reduces the masseter and temporalis contraction force between 70 and 85%. So how is it possible that you can reduce or take away the muscle's ability to contract, yet you are then simultaneously increasing the load in a joint? They also talk about how there's no posterior support in place. And that's a major problem with these appliances, that there has to be back teeth in place. Well, just look at our patient population. People who lose their molars, why don't they automatically develop a temporomandibular joint problem if they don't have any posterior support? Someone who only has their anterior 6 teeth, they should automatically have a joint problem because shouldn't they be loading their joint every time they close? It's just not founded. So, I've come full circle and I welcome and really look for these appliances to be my go-to appliance for patients who have migraines, patients who wake up in the morning with headaches, because we don't want to have posterior teeth in contact if the person is a clencher, because if they clench with back teeth in place, they can in fact increase the temporalis and masseter force, and we want to cut that down. So, I've come full circle and I really welcome and I advise many people to use these appliances as protective appliances, as migraine appliances, as headache appliances, and as even a routine go-to parafunctional control appliance.